اليوم رح نحكي عن الجزء الثالث والأخير للإنفلامation. And next week we're going to start something a bit more exciting, which is immunology and the immune diseases. Okay, inflammation. Now, كنا عم نحكي عن anatomic characteristics of chronic inflammation من قبل. Sorry, acute inflammation من قبل يلي هن rubor, calor, dolor, and tumor. يلي هن whenever there's acute inflammation you're going to find usually all four, not always all four, and then you have functiolese, which is the loss of function. But in chronic inflammation, it's because it is less in acute, because it is less intense than acute inflammation. ما راح نشوف هالاحمرار والحماوة والوجع والتنفخ بالاعضاء يلي بنشوفها بالacute inflammation. So in fact ممكن يصير بالقلب يلي هو انه السكار تيشو لانه كتير جامد وكتير قاسي ما بيمط. It's not elastic, and so the site may be shrunken by the scar أو ممكن يصير في atrophy أو حتى necrosis. So the example is لما يكون عندنا chronic inflammation in the muscle becomes small and atrophic. And so microscopically, instead of the neutrophils يلي كنا نشوفهم بالacute inflammation رح نشوف أكتر هلا the macrophages which are known by various names حسب التيشو يلي بيقعدوا فيها. So إذا كانوا بالليفر بيصير اسمهم Kupffer cells، إذا كانوا قاعدين بالدماغ بنسميهم glial cells أو microglia. And the macrophages themselves they usually arise in the bone marrow. They circulate the blood as monocytes, but then when they differentiate they become macrophages، وهذا من بعد ما يكونوا فاتوا على قلب التيشوز. واللايف سبان اللي لهم المونوسايتس كانوا a few days. The macrophages, they have a lifespan of, they're very long, it's usually months or years. they are phagocytes. شغلة الفاغوسايتس وهذه رح نشوفها باللكتشر الاميونولوجي انه they present antigens to the white blood cells. So they eat stuff and everything they phagocyte, they break down, and then they present the antigens. There's a certain way to present it to the passing lymphocytes. Sorry. So macrophages also secrete a variety of cytokines, metal enzymes, coagulation factors, special proteins that facilitate immune reactions, etc. So these they're the coordinators, let's say, of the white blood cells. So there are also lymphocytes and plasma cells. We have B lymphocytes and we have T lymphocytes. Now the B lymphocytes, they're called B lymphocytes because they mature in the bone marrow. The T lymphocytes, they mature in the thymus. And so in the image that we see right now, this is a fluorescence microscope image that shows we have the this is a cancer cell, and we have CD8 positive cells and the T cells. They are surrounding the cancer cell in an attempt to completely destroy the cancer cell. And so the T lymphocytes, they either coordinate the work of the B lymphocytes, or they work by destroying cells. The B lymphocytes, they are responsible for something called the humoral response, which is usually releasing antibodies and destroying the cells through antibodies. Now, there are distant effects of inflammation، وهذه بغض النظر إن كانت chronic أو إن كانت شو اسمه هذا، إن كانت chronic أو إن كانت acute. Now, the lymphatic system is going to be involved in inflammation. The lymphatic system is a system of vessels that do not have blood. وهول vessels عادة unidirectional بيروحوا from the distal body parts all the way into the center of the body, and they cover all the organs except the brain. شغلتهم انه يعملوا drainage للinterstitial fluid, and along the vessels في عنا lymph nodes, and these are like filters. They filter the lymph that passes through, and eventually they all land in a vessel in one of the veins, somewhere in the upper chest. I'm not going to go into the anatomy of where it goes. And the lymph nodes, لأنهم هن مصفية الليمف, they trap the bacteria. اعتبروه مثل حواجز. شغلتهم إنه أي lymph قاطع, there are lots of white blood cells بقلب lymph nodes, and they can detect the bacteria, and they can destroy the bacteria or any foreign material. And they also play a role in delaying the spread of cancer cells. This is why لما يكون في عنا cancer بمنطقة معينة, the lymph nodes that immediately drain the area that has the cancer are going to be inflamed, بيكونوا كبرانين شوي. An example is the breast cancer. So one of the hallmarks of breast cancer هو enlarged lymph nodes تحت الباط. So تحت الباط في عنا lymph nodes that drain the breast, and if we have a cancer cell that went into those lymph nodes, the lymph node is going to be large. And this is why بالself exam للbreast cancer, palpation is not just on the breast, بتمتد لتحت الباط كمان. Okay, so if we have inflammation of the lymph vessels, بيصير عنا a condition called lymphangitis. They are red, they are very painful, and they are delineated streaks. And the resolution is by treating the primary infection. You don't do anything to the lymph vessels. They're only inflamed because of some primary infection. Now, lymphadenitis. It's defined as the inflammation of a lymph node, not a lymph vessel. They are enlarged, they are tender, they could be both. بتصير because of reactive hyperplasia. It could be either because of malignancy مثل breast cancer اللي حكيتكم عنه, أو due to an infection. So, if it is because of an infection, this is an example of lymphadenitis. فيكم تلاحظوا هون الرقبة شوي inflamed. ليه؟ لأنه we have lymph nodes that drain the throat area. So if we have tonsillitis for whichever reason, the tonsils are drained by the posterior triangle of the neck, and أول lymph nodes بيوصل any virus أو bacteria من tonsillitis, they're going to be inflamed, and in severe cases they can become very large and you can actually see them. مرات كتير إذا زلايمكم عم يجعوكم, if you palpate الرقبة, you can actually feel like there's a lymph node كبران أكبر من الجهة التانية. Now, continuing with the systemic effects of inflammation, you have to understand that the products of inflammation, they're soluble, and they're soluble in plasma, and they usually don't stay in situ. ما بيبقوا محلهم. They have effects on all the body parts, especially the brain. والدماغ هو اللي شغلته انه يعمل الحرارة واللشلشة والدوخة والpoor appetite. ما بيقعد لنا نفس ناكل. They also increase blood pressure, either by vasoconstriction or by effect on the kidneys. They cause suppression of albumin production, and they increase white blood cell production, وبيصير عندنا production of CRP and fibrinogen. هلا رح نفوت بالضبط what CRP is and what fibrinogen is. So CRP, or C-reactive protein, it is a protein that is made exclusively in the liver. وهيدا البروتين بتبلش تزيد مع الانفلاميشن. سو كل ما عندنا inflammation اعلى كل ما السي ار بي رح يكون اعلى عن الطبيعي. And this inflammation is not very non-specific. It could be any cause of inflammation بيرفع ال CRP. وهيدي it's a laboratory way to differentiate between being sick from being well. Now, there is inflammation that can come from atherosclerosis, cancer, even obesity, Alzheimer's disease, في يكون عندنا rheumatoid arthritis, etc. It all increases the CRP. فحص السي ار بي لوحده ما له قيمه. اذا عمل هلا اذا حدا ركض ماراثون وسحبت له السي ار بي بيطلع السي ار بي عالي لانه the stress that the marathon puts on the body creates a generalized inflammation. ما بتضاين كتير بس it is nonetheless an inflammation. And so
Doctor,
yes,
يعني it's used like for screening يعني مش diagnostic.
بالعكس, you cannot use it for screening. That's the whole point. Because it is so non-specific. It only tells you there's inflammation. So what do you use it for? I'll give you two examples where you can use CRP very well. أول واحد هو rheumatoid arthritis. So you want to know إذا حالة rheumatoid arthritis عم تسيء أو إنه عم تتحسن. You take a baseline CRP, right? And so you know your CRP is here, let's say in rheumatoid arthritis. And then you give a medication. And you monitor the CRP and see if it is decreasing, then the medication is working. If it is not decreasing or increasing slightly, the medication is not working. The other one is tuberculosis. You can use it the same way. So CRP is high in tuberculosis, is extremely high in tuberculosis, but it's mid-range in pneumonia. So you have a pneumonia, شاكين انه يكون tuberculosis. ما بدي انطر نتيجة الزرع ما بدي انطر نتيجة الculture. And so the solution is basically to do a CRP. It will give you an idea. But CRP on its own, you cannot use it to screen what? You don't even know what the inflammation is. And it's problematic. في كتير حكمة بيستعملوا CRP. CRP عالي معناتها عندك التهاب. Okay, great. التهاب بشو? I don't know. So this is a problem. The other one is fibrinogen. It's also made in the liver, and it's a coagulation. It is basically a coagulation protein that polymerizes. هي اللي بتعمل البلاد clots. And fibrinogen has a very weird effect on red blood cells. They start forming rouleau formations and they settle immediately in plasma. And so we can use this effect يلي هو erythrocyte sedimentation rate. We can test it in the lab, and when you test it, so if your ESR is high, you can get an idea that there is an inflammatory response happening somewhere. It's also very non-specific, but it does give you an idea that there is inflammation. Okay, so systemic manifestations of inflammation. And I'm going to be talking about it like a timeline over here. Now, there are three sort of phases يلي بيفوت فيها الجسم لما يكون في inflammation. في عنا the acute phase response. And this is usually very localized. It will start within hours to days. هي نتيجة cellular و systemic manifestations سببها الانفلاميشن أو الانفكشن. اوكي سو ببلش يصير عندنا تغيرات بالكونسنتريشنز بالبلازما بروتين مثل السي ار بي مثل الفايبرينوجين. بيصير عندنا سكيلتال ماسل كاتابوليزم. وبيصير عندنا شيء اسمه نيجاتيف نيتروجين بالانس in which عم نستهلك أكثر amino acids than we are actually eating. And the acute elevated response منبلش نشوف elevated ESR, منبلش نشوف elevated serum amyloid protein, which is the family of TNF alpha with interleukin 1. And we're going to see an increased CRP and fibrinogen levels because of the interleukin 6. So this serum amyloid protein increases when TNF alpha and interleukin 1 are released. بينما the interleukin 6 causes the increase of CRP fibrinogen levels. And what usually happens is the SAA protein, it replaces the apolipoprotein A, which is a component of the high density lipoprotein particles. And this presumably increases the transfer of HDLs from liver cells to macrophages, which can then utilize these particles for energy. Which means that لما يرتفع السيرم amyloid protein بنكون عم نحول the high density lipoproteins into macrophages so that they can use them as fuel for energy. And you're going to see an increased numbers of leukocytes. The number will start to increase beyond 10,000. Sometimes it reaches 15,000 to 20,000 cells per cubic millimeter. And you're going to have fever, increased heart rate, anorexia, somnolescence, and malaise. كل العوارض اللي بنحس فيها لما يكون عندنا حرارة. So, like I said, white blood cells are going to increase substantially, and keep in mind that circulating neutrophils have a lifespan of only about 10 hours. So you're going to have an increased production of white blood cells in the bone marrow, and this increased white blood cell count راح يطلعوا كتير منهم immature بنسميهم bands. وهون تجي جملة there's a phrase اللي بتقول shift to the left أو صار عندنا segmented segmentation للwhite blood cells, and هذا بالديفرنشال كاونت لما نعمل السي بي سي, and this is mostly because of immature neutrophils يلي بنشوفها بالسيفير infections. And then you this is part of the white blood cell response يلي هي خلصنا نحن من ال acute response, and then you're going to get an increase in neutrophils, neutrophilia if you have bacterial infections. You're going to get eosinophilia if you get parasitic or allergic responses, and if you have viral infections, viruses for some reason they cause neutropenia, which is a decrease بالنeutrophils, وبيزيدوا lymphocytes, lymphocytosis, لأنه lymphocytes هن اللي راح eventually especially the B lymphocytes, they're going to transform into plasma cells, which will produce the antibodies that attack the viral infections. And then you have the systemic response, which is the fever, and you get you have to keep in mind we have a normal variation in the temperature, the core body temperature اللي قلنا. So تنتقل من 36 درجة ل 37 ونص، وهذه بتختلف حسب النهار. أكثر شيء بتكون عالية بعد الظهر، وبنص الليل وبنص الليل بتكون أوطى شيء. And but the fever by itself عادة اللي بيصير is this. نحن اللي بيتحكم بجسمنا بحرارة الجسم هي الهايبوثالاموس. And so the hypothalamus بيحط إنه أنا بدي حرارة الجسم تكون بين رقم ورقم. لما يصير في عنا cytokine releases, الset point نتاع الهايبوثالاميك regulatory center بيقوم بيعلى. So بيقرر الهايبوثالاموس إنه أنا الماكسيموم temperature اللي بدي حافظ عليها منا 37.5 degrees، لازم تكون أعلى. And then لما نوصل لهيدي النسبة العالية من الحرارة عادة ما بترتفع أكثر من 41 degrees. Keep that in mind. Fevers that are higher than 41 degrees سببهم منن الهايبوثالاموس. They're usually either hypermetabolic states او في عندنا مشكله بالهايبوثالاموس itself. اوكي سو قررنا انه بدنا نرفع ل 41 degrees. How does it do it? It's going to رح يعطينا احساس بالبرد تنقوم نضطر نلبس زياده تنحافظ على الحراره اللي قلنا، ورح نبلش شيفرينج، الرجه اللي بنحس فيها لما يكون علينا حراره. هيدي هدفها انه ترفع حراره الجسم تيوصل ل a certain level يلي حطه الهايبوثالاموس. So the cycle begins like this. You have the release of prostaglandin E2 or other fever producing cytokines. It resets the thermostatic set point. By the way, the arrow is wrong على هيدي الصورة. It should be a bit higher لأنه this is the pituitary, not the hypothalamus. And then you get temperature raising responses مثل vasoconstriction, shivering, increased metabolism. When it reaches the new set point, then you have mechanisms حتى تبلش تخفف الحرارة يلي هي منبلش نعرق، ببلش الفازودايليشن ومنبلش نتنفس بسرعة أعلى. And the fever is usually caused by either السيتوكاينز يلي الجسم بيفرزها، أو ممكن تكون بروتينز البكتيريا السيل ممبرينز من بعد ما تكسرت هذه البكتيريا هي بلشت ترفع الحرارة. وممكن تكون something completely different يلي هو إنه ما في عنا infection، في عنا inflammation due to leukemia أو Hodgkin's disease، لأنه هول كمان بينزلوا a certain amount of cytokines. ممكن يكون عنا internal proteins from non-infectious disorders مثل المyocardial infarction أو pulmonary embolism. وفي يكون عنا الكيموتاكتيك molecules مثل ما قلت لكم من ال white blood cells مثل cytokines. And so we get something called the pyrogens يلي هن pyro is Latin for fire, and gen is genesis, which means we are creating a fire, which means we are raising the temperature, or known as a fever. And so you get something, you have endogenous and exogenous pyrogens. Now, في منهم بيشتغلوا مباشرة على الهايبوثالاميك thermoregulatory center. في هول في بعض البايروجينز بنسميهم exogenous pyrogens، والاكزوجينس بايروجينز بيشتغلوا مباشرة، عادة بياخدوا وقت طويل تيعطوا مفعولهم، بس الطريقة اللي بيشتغلوا فيها انه بيشتغلوا through other mediators, and then اشرح لكم اياها بطريقة تانية. Okay, so some pyrogens act directly on the hypothalamic thermoregulatory center تيعلي الset point. Pyrogens تانيين يلي بنسميهم exogenous pyrogens, they act indirectly or they require usually several hours to produce their effect. Exogenous pyrogens they induce host cells such as white blood cells or macrophages to produce endogenous pyrogens. بالنهاية تنرفع الحرارة you always need endogenous pyrogens، بس endogenous pyrogens they could be due to exogenous pyrogens جاي شيء من خارج الجسم. And usually من بعد ما يرفع الset point ساعتها بنوصل للفيفر. No. So السؤال الأساسي هو إنه okay, so شو الهدف من الفيفر؟ Why would we create a febrile response? There are two hypotheses. One of them says we don't know why fever, but the other one says إنه there's something called بيصير sequestration of iron. لما ترتفع الحرارة الحديد يلي عم يمشي بقلب الدم ببلش يتخزن بقلب الكبد. على ارتفاع الحرارة. والحديد ضروري جدا لبعض البكتيريا, and a lot of bacteria cannot work if the iron concentration is low in the blood, and this helps to a certain extent to stop the spread of bacterial infections. But the main reason is still unknown why we get fever. There are different patterns of fevers, and the pattern of fever really depends on the reason of the fever. So we get something called intermittent fever. Intermittent fever هي اللي أكتر شيء بنشوفها لما يكون عندنا infections, إن كانت bacterial infection أو certain viral infections. There could be sepsis, abscess أو endocarditis. وهذا النوع من الفيفر بنشوف إنه بالنهار بنكون ما شفنا شيء, بعد الظهر تطلع الحرارة, طول الليل محرورين, بعدين نرجع الصبح ما شفنا شيء, and it's a cyclical fever. Then you get fever caused by certain medications or recreational drugs اللي بنسميها remittent fever. So you have a sustained fever all the time, بس تطلع وبتنزل within the high ranges اللي إلها, ولا مرة بترجع للنورمال. And then you get something called a relapsing fever, which is you get a fever, بيقطع بعض الأيام you have normal temperature, ترجع تعلى الفيفر اللي إلنا. And you usually see it be parasitic infections and tuberculosis, especially malaria. Malaria, بكرة بتدرسوها بالميكروبيولوجي. One of the ways to differentiate between the different treponema infections of malaria is to know the cycle of the fever. So you will know إذا كل 3 أيام أو كل 4 أيام you get fever. إذا كل 3 أيام بتكون شيء, إذا كل 4 أيام بتكون شيء تاني. والعلاج شوي بيختلف حسب أيام الفيفر يلي بتصير معهم. And then we get the manifestations of fever. Now, fever goes through, 4, let's say, stages of fever. You have the prodrome يلي ببلش وجع راس صغير, تعب, لشلشي. من بعدها ببلش التشيل يلي هو منبلش نحس حالنا بردانين ومنبلش نرجف. الجسم عم يجبرنا انه نعلي الحرارة تنوصل للست بوينت الجديد يلي حطها الهايبوثالاموس. and then بس نوصل لهيدي الست بوينت اللي حطها الهايبوثالاموس نوصل بالفلاش بيريد يلي هي vasodilation. بنشوفها كتير انه الخدود بلشوا يحمروا, and then you get a warm feeling ومنحس حالنا عم نحترق. ومن بعدها ساعتها بيصيرنا الديفرفسنس, الحرارة بتبلش توطى ومنبلش نعرق. العرق منه نتيجة الحرارة اللي عم توطى بالقلب, الحرارة عم توطى لأنه عم نعرق, عم يحاول الهايبوثالاموس إنه يرجع يوطي الست بوينت للحرارة.
دكتور يعني عم يعمل مثل homeostasis.
100%. So the whole point of the body is to always the whole point is to always reach the homeostatic point 100%. قبل ما احكي عن اخر سلايد بس تشوف الاسئله. حليمة عم تسألني انه ليه السي ار بي ما بياخد كتير وقت وهو what do you mean? Can you rephrase your question حليمة؟
دكتور انت قلت انه في بعض حكماء بيستخدموا ال CRP بدل الكالتشر. هل هو انه more sensitive او هو ما بده وقت؟
اوكي. نو مش بيستخدموه بدل الكالتشر. In the case of tuberculosis it will give you a quicker response than cultures. Cultures بدهم يومين, والtuberculosis الكالتشر تاخد وقت أطول تتبين. And so ما بدنا هذا المريض يكون معه tuberculosis, an advanced case of tuberculosis, ونكون عم نعطيه الأدوية الغلط. So we do cultures and CRP. ال CRP إذا طلع كتير عالي دغري منبلش anti-tuberculin medications عبنا تطلع الكالتشر. اذا طلع السي ار بي واطي نسبيا ساعتها لا نطمن انه most probably it is not tuberculosis. It's only a way to manage. Now في حكمة كتير بيعتمدوا على السي ار بي بحد ذاته, but that's not a good idea لأنه it's very non-specific. It doesn't tell you anything. ما رح يخبرك شيء. I hope that answers your question.
Yes, doctor. Thank you.
Okay. So Ragad is asking because hepcidin increases during inflammation. What? Come in. Restate your question لأنه ده.
دكتور لما كنا بالسلايد تبع الواي فيفر تبع sequestration of iron,
Yes.
I asked if this is the reason.
Yes. The sequestration of iron is done via hepcidin. Absolutely. So الجسم بيفرزوا أصلاً to sequestrate the iron. Yes, absolutely. So okay, so the management of fever. If we do not know the cause of the fever, بنسميها fever of unknown origins. But the management of fever should always focus on managing the cause. Now, مرات كتير within 48 hours of fever تبين الكوز. So هيك نشوفها كتير بالبيدياتريكس لما كنت أقطع بالاي ار نتاع of AUBMC كان يجينا the first 24 hours babies they have fever but they have really no sign of where the infection is. And you do need to manage the fever مش لا بس you cannot tell مرات كتير شو السبب. And so you manage it empirically with antipyretics. Antipyretics اللي هو anti-inflammatory medications مثل paracetamol مثل ibuprofen. There are indications of how to use each one. It is very important to replenish fluids. لأن during fever we lose a lot of fluids through sweat and through perspiration. ما تنسوا إنه during fever the body switches from using glucose, which by the way is an excellent medium for bacterial growth, to metabolism based on proteins and fat breakdown. Protein and fat breakdown requires a lot of fluid, a lot of water, and so you need to replenish the fluids that you are losing. And أكيد إذا الفات breakdown is very very rapid بصير عندنا شيء اسمه metabolic acidosis. And metabolic acidosis also requires fluids so you can rebalance your blood pH. And if all else fails you need to use sponge bath. ما بعرف إذا سمعين التعبير لتخط مي فاترة. So we literally بنكمش شقفة عليها مي وبنحطها على الجبين. ما بدها تكون مي مسقعة, and this is very important. إذا المي مسقعة بتعمل vasoconstriction and the heat will be trapped inside the head and the body. بس حمام مي فاترة كتير بيخفف الحرارة لأنه you're trying to take away all the heat that the body is producing through metabolic processes. And so fever that is usually refractory to antipyretics is actually very dangerous, and if left unchecked it could actually lead to death. بس عادة whole fevers ما بيكون سببهم الhypothalamus. It is not a physiological fever. بيكون عندنا مشكلة أكبر that you need to treat the cause for it. And that concludes our inflammation lectures, the 3 lectures. مثل ما قلت لكم نحن ان شاء الله نهار الاثنين رح نبلش بموضوع جديد, موضوع احلى يلي هو الاميون system. So does anyone have any question about inflammation?
يعطيك العافية دكتور.
Thank you.
يعطيك العافية دكتور.
Okay. So as usual رح حط هلا lecture online Or if anyone has any question, please feel free to email me, or you can always ask me in the next session. And great, have a nice day.